We see a lot of people in our practice with heel pain. It's an extremely common problem. And typically they'll present with pain on rising in the morning, especially when they get out of bed. We also see patients complain about pain when they sit after sitting for a long period of time, getting out of a car or at a theater, and they go to walk and they have to hobble for the first few steps until such time as the pain sort of works out. And what's really happening there is that the plantar fascia, which is a ligament-like structure in the bottom of the foot, it contracts over a period of time when you're non-weight bearing, and when you then get up on it, it has to re-stretch or expand. And this is all due to the inflammatory process that is taking place in the plantar fascia. Essentially, it's a strain of the foot, and this strain is brought about by a biomechanical fault or a imbalance in the foot, and so that's really the cause. The pain actually arises from the inflammation that is occurring in the insertion of that ligament-like structure into the bottom of the heel. And over time, it can even generate a reaction at the bone level that causes a spur, so-called heel spur, to form. The spur itself is not painful, but the inflammation of the ligament is. And that's what we treat initially. You key in on treating the inflammatory process with oral anti-inflammatories, injection therapy, and the like. Sometimes we incorporate physical therapy into this. But that's treating the symptoms and not really the problem. The underlying problem is the biomechanics of the foot and the stress and strain within the structure of the foot itself. So in order to treat that, we'll often use a temporary insert to support the arch of the foot to see how the patient does with that. And if it shows promise, then we might prescribe a functional orthotic, which is a custom-made insert that does for your feet what glasses do for your eyes, rebalance that structure so that the strain is off of the plantar fascia. And this happens to work in 85 to 90% of patients, and pretty much that's all we have to do for them. On occasion, there are patients who do not respond to conservative management, and those patients go on to surgery, and most of those do very, very well. But it's important to realize that you don't have to live with heel pain, that this is something that's extremely treatable, and most people do very, very well with conservative management.